I'm Dan Perry with the Alliance for Aging Research. We're your hosts today. Pleased to see that you have availed yourselves of the lunches. And we're now going to hear from a very engaging and enlightening group of experts who will be talking to us today at the release of our latest volume of the Silver Book series. Today's volume captures all of the most relevant and important information about thrombosis. With thrombosis, we're talking about formation of blood clots that can both be the cause of serious but all too common health threats in older Americans, or they can be the result. These conditions can be the result of the formation of blood clots. And all of this is captured in the Silver Book, which we're releasing today. These particular threats that we look at, and there are three, are especially dangerous for older patients, and they are the three conditions for which there is the most data available from various think tanks, academic health centers, and data sets. So the three we're talking about today are atrial fibrillation, better known as AFib, and you will hear a lot about that from the top experts. Also, venous thromboembolism, or VTE. This is the formation of blood clots in the large veins. And we all know about stroke, and stroke is one of those conditions that doesn't cause blood clots, but is most often caused by the formation of a blood clot, which then can lead to myocardial infarction, heart attack, or more likely, very disabling stroke, which with the aging of our population, all of these conditions, unfortunately, are ones that we're going to see have an ever larger impact on healthcare in the U.S. Not only the delivery of healthcare, but the costs of healthcare. And if there's anyone in this room that ever has to worry about healthcare costs, I don't know who that might be, these are issues that sort of fly beneath the radar, these thrombolytic events and dangers. And that's why we're bringing them to you today in this format. As I'm sure you're all aware, January of this year was sort of the kickoff date, 2011, when the first of our largest generation, the post-World War II baby boomers, start turning age 65. In fact, we have successfully added to your average life expectancy and that of your parents and your children 50% additional years than what we looked at back at the turn of the 20th century. It's an amazing accomplishment. And in fact, you'd have to go back 5,000 years in human history to find a comparable time when we added 50% to average life expectancy. That's the good news. The not so good news is that so many of those additional years of life are shadowed by higher risks and incidence of chronic age-related diseases, from cancer to heart disease to diabetes to Alzheimer's disease. And we want policymakers to understand and appreciate and act ultimately to help blunt the impact of these chronic diseases of aging. And hence, we have been publishing this series of Silver Books now for 5 years. It started in 2006. We have produced a number of volumes, and for those of you that are on congressional staffs, this is your one place stop. This is where you can get all of the most validated, credible, authoritative statistics on the incidence of the condition, the impact on your communities and on society, the costs, the projections of how these numbers will increase as we see our population age more and more as the baby boom generation moves beyond 65 and into their late 60s and their 70s and 80s. And importantly, we capture the insights of the most noted experts and think tanks on where the innovations might come to blunt the impact of these diseases. The innovations that could very well reduce the costs, the mounting costs of chronic diseases of aging, and help people, your constituents, live longer and better lives. Some of the conditions for which we have produced these silver books in the past include heart disease, diabetes, neurological diseases like Alzheimer's and Parkinson's, osteoporosis, vision loss, and now to this growing library, we are adding silver book thrombosis. We're doing this because of the impact on the public. Atrial fibrillation, which you will hear much more about from our experts, is diagnosed in some 75,000 people, new ones, every year. VTEs, or venous thromboembolism, diagnosed in 900,000 people every year, and 800,000 Americans suffer a stroke. Altogether, some 2 million Americans die from a thrombosis event every year, and the cost to the U.S. healthcare system are very nearly $74 billion. So it is a significant area for you to understand as policymakers, and that's why we bring this to you. Now, because we want these silver books to be the most current and the most up-to-date, when you walk out of here today, this is likely, or within a day or two, may be out of date. Why? Because there'll be a new study, something even more current and pertinent. So we have a website, silverbook.org, and specifically for today's release, it'll be silverbook.org/thrombosis. And we will continually refresh this information. You can go on this site and you can search anything within the the database that you're looking for. You can pull up behind any one of these brief factoids, these little headlines that are in there. You can pull up the original document. In most cases where it's available, you can then click through to the document if you're really digging into this issue for your boss's next speech or the next time they're going to be talking about this issue. So it is a fully searchable and I think very usable database. It also has the capacity to have new data put into it so that it does stay entirely up to date. In your kits, you will find a postcard that will have more information on the website and how you can make the best use of it. Moving on, for today's event and the launch of this new silver book, we are very grateful to Daiichi Sankyo for the resources that have made this possible. And we're very pleased to have the partnership of two very important groups that have pioneered in this field: the Preventive Cardiovascular Nurses Association and StopAFib.org. And they are our partners for today's briefing. And I will be pleased to introduce to you the chief executive officers of both of those organizations, and their biographical sketches are also in your kit. So I will begin by recognizing Sue Koob, who is the CEO of the Preventive Cardiovascular Nurses Association. She has been in that position for more than 11 years. And the organization is the leading nursing organization that's dedicated to preventing cardiovascular disease, the #1 killer of American women as well as men. And they do this through integration of both public and professional education and advocacy. Our other CEO partner today is Melanie True Hills. She's the founder and CEO of stopafib.org, and that's a patient-to-patient resource to help patients with atrial fibrillation to control their disease. And before I hand the podium over to Sue and then Melanie, I'd also like to give a special thanks and shout out to Congressman Brian Bilbray of California and to his staff, Gary Klein and Ashton Rossi, for arranging for us to use this room. So I will be back to talk and introduce our other speakers, but for now we're going to start with Sue Koob. Sue?